As people age, balance naturally becomes more fragile due to changes in muscle strength, joint flexibility, and sensory input. One of the most overlooked yet critical contributors to poor balance and increased fall risk is improper footwear. The shoes seniors wear can either support stability and confidence or silently sabotage every step. Many older adults choose footwear for comfort, convenience, or habit. Unfortunately, these choices often lead to dangerous outcomes. Common examples include wearing loose-fitting slippers, flip-flops, high heels, or worn-out shoes with smooth soles. These types of footwear lack the support, grip, and structure needed to help aging bodies stay steady, especially on uneven surfaces or slippery floors. Slippers, especially backless or soft-soled ones, are a major culprit in home-related falls. While they feel cozy, they often don't provide adequate heel support or grip. Seniors may shuffle when walking in them to keep them on, which increases tripping risk. Flip-flops pose a similar danger. The minimal sole and lack of foot coverage make it easy to trip over a rug edge or misstep on stairs. Worn-out shoes, especially those with smooth or hardened soles, are also dangerous. Over time, shoes lose their tread, cushioning, and shape. This reduces shock absorption and ground grip, the elements needed for maintaining balance. Even supportive shoes can become a hazard once they're past their prime. Another common issue is wearing shoes that don't fit properly. Feet change shape with age due to loss of fat padding, changes in arches, and swelling. Ill-fitting shoes, either too tight or too loose, can cause discomfort, foot pain, and unstable footing. Seniors often tolerate poor fit because they're used to their old size, but this compromise increases the risk of falls significantly. Doctors and physical therapists consistently emphasize the importance of choosing footwear designed for stability. Good balance-friendly shoes should have a non-slip rubber sole, low, wide heel or no heel, a secure fit with laces or Velcro straps, good arch support and cushioning, a firm heel counter, the part that cups the heel for extra control. In addition, 2 indoor and outdoor shoes. Some seniors benefit from orthopedic inserts or custom insoles, which improve foot alignment and reduce discomfort. These can make walking more stable and enjoyable. Encouraging mobility. For those with balance issues or foot conditions, it's a good idea to consult a podiatrist or physical therapist for footwear recommendations. They can assess gait, posture, and pressure points to suggest shoes that meet individual needs. Ultimately, choosing the right footwear is a simple yet powerful way to prevent falls. It's not just about style or comfort. It's a matter of safety, independence, and quality of life. By wearing the right shoes, seniors can walk more confidently, reduce their fear of falling, and stay active for years to come. As we age, it's common to take more medications to manage chronic conditions like high blood pressure, diabetes, arthritis, or sleep problems. But what many seniors and even caregivers don't realize is that some medications or combinations of them can directly affect balance, causing dizziness, lightheadedness, or even sudden drops in blood pressure. These effects significantly increase the risk of falls in older adults. Dizziness is one of the most common side effects reported by seniors. It can feel like the room is spinning, vertigo, like you're floating, or like you're about to faint. All of these sensations can affect a person's ability to walk steadily, stand from a seated position, or even turn around safely. The issue isn't just uncomfortable, it's dangerous. Common medication types that affect balance. Blood pressure medications, antihypertensives, these help manage high blood pressure. But some types like diuretics, beta blockers, and ACE inhibitors cause orthostatic hypotension, a sudden drop in blood pressure when standing up. This often leads to dizziness or fainting. Sedatives and sleep aids, drugs like benzodiazepines, for example, diazepam or lorazepam, and over-the-counter sleep medications containing diphenhydramine can cause drowsiness, confusion, and slowed reaction times, impairing balance and coordination. Antidepressants and antipsychotics affect brain chemistry and can lead to dizziness, sedation, or blurred vision, particularly when starting or adjusting doses. Pain medications, especially opioids, can cause drowsiness, dizziness, and slower reflexes, increasing the risk of falls, especially in frail seniors. Medications for Parkinson's or diabetes, these can sometimes cause sudden changes in blood pressure or blood sugar levels, both of which can cause lightheadedness or imbalance. Why seniors are more vulnerable. As we age, the body processes medications more slowly. The liver and kidneys don't clear drugs as efficiently, meaning medications can stay in the body longer and accumulate to stronger than intended levels. Seniors are also more likely to be taking multiple medications, polypharmacy, which increases the chance of drug interactions that affect the nervous system or balance. What can be done? Medication reviews. Doctors and pharmacists recommend that seniors have their medications reviewed at least once a year, or whenever a new drug is added. This helps catch risky side effects and interactions early. Start low. Go slow. For seniors, doctors often follow the rule of starting at the lowest dose possible and adjusting slowly. This minimizes side effects like dizziness. Timing matters. Taking certain medications at night, like blood pressure meds or sedatives, can reduce the impact on balance during daytime activities. Stay hydrated. Dehydration can make dizziness worse and is common in seniors, especially those on diuretics. Drinking enough fluids is essential. Final thought: medications are often essential for managing health, but they must be carefully balanced with safety. If you or a loved one is experiencing dizziness, don't assume it's just aging talk to a healthcare provider. Sometimes, simply adjusting a dose or switching medications can restore balance. Literally. One of the most preventable causes of poor balance in seniors is a lack of regular movement. As people age, especially past 80, common to slow down, avoid physical activity due to pain, fatigue, or fear of falling. But, ironically, the less you move, the more at risk you become of falling. Inactivity leads to muscle weakness, poor joint flexibility, slower reflexes, and ultimately, a loss of balance control. When muscles aren't used regularly, they begin to atrophy, which means they shrink and lose strength. The leg muscles, particularly those around the hips, thighs, knees, and ankles, are most critical for maintaining posture and stability. These muscles help us stand up from a chair, walk confidently, change direction, and catch ourselves. If we trip without regular use, they weaken rapidly, especially in the elderly. Balance isn't just about muscles, it's also about coordination. Your brain, inner ears, vestibular system, eyes, joints, and feet all work together to keep you upright. When you stop moving frequently, this system becomes less responsive. The brain stops getting the practice it needs to respond to shifts in balance. Over time, this makes the body more vulnerable to falls, even from simple movements like turning quickly or stepping off a curb. Common consequences of inactivity in seniors: weakened legs and core muscle, stiff joints, especially in knees and ankles, slower reflexes when tripping or skipping, poor posture and gait, walking pattern, reduced confidence in movement, leading to even more inactivity. This creates a dangerous fear of falling cycle. A senior feels unsteady, gives they avoid movement, gives muscles weaken further, gives balance gets worse, gives they feel even more unsteady. The good news: it's reversible. Even small amounts of daily movement can strengthen balance-related muscles and reduce fall risk. You don't need a gym or special equipment, just consistency and the right type of activity. Recommended activities: walking, a brisk 10 to 20 minute walk, daily helps maintain leg strength and cardiovascular health. Chair exercises, seated leg lifts, toe taps, or arm raises are perfect for those with limited mobility. Balance exercises: try standing on one foot, heel-to-toe walking, or simple Tai Chi movements to improve coordination and posture. Strength training: light resistance bands or bodyweight exercises like wall push-ups or sit-to-stand from a chair help rebuild muscle tone. Stretching and flexibility: gentle stretching keeps joints mobile and helps with smoother, more controlled movements. Start slow. Stay safe. It's important to check with a healthcare provider or physical therapist before starting a new routine, especially for those with existing health conditions or frailty. Many communities offer senior fitness classes or home-based programs tailored for older adults. Final thought: movement is medicine, especially for balance. Staying active doesn't mean strenuous workouts. It means giving your body the regular movement it needs to stay strong, steady, and independent. A few minutes each day can make a life-changing difference in preventing falls and boosting confidence. Most people think of balance as purely a physical function: strong muscles, steady feet, and good reflexes. But balance is also deeply tied to your senses, especially vision and hearing. As we age, changes in eyesight and hearing are common. but they're often underestimated in how much they impact overall stability. In fact, poor vision and hearing are major contributors to falls in people over 80. How vision affects balance. Your eyes constantly send signals to your brain about your position in space. They help you detect obstacles, uneven surfaces, stairs, changes in lighting, and more. When vision declines, so does the brain's ability to make quick and accurate adjustments.